Right now I'm, traveling, but I've been working all day. So
Yeah. Just you see, your day sounds pretty normal. Running a company. I own a small business, so I get that. You had brought up as far as seeing if you're going to hire new people or fire people or that sort of thing. Has the past month has it affected like hiring new people? Have you hired more people, or has it not had any effect? I know you've been on. Sometimes it probably felt like a media whirlwind. And we'll get to that, but has there been negative effects to your company from kind of the internet calling you the most hated man?
yeah, I mean, there's certainly effects. So in terms of HR, we haven't had anyone leave, which is great. All of our team, in fact, a lot of our team is even more committed. We actually do have HIV positive employees. We have a significant number of LGBT employees. Everyone sort of confirmed they're part of this mission. They want to be part of this, what we're doing. So no one's left because of the controversy. I
Yeah.
will say hiring people is a little harder. There are people that, I mean, there's sort of a good part and a bad part. I mean, the bad part is there are definitely people that don't want to work here because they think it would be either bad for their career or they don't understand it or whatever. But it's actually also attracted a lot of people too. So that's kind of cool. People didn't know who we were before. There are people that kind of like to go help a company that's, in going through something. That's often how you create the most value. If you're at a company that's just kind of ho-hum and boring, it's sometimes not exciting to be a part of a company like that. So there's a number of people that want to join our company. We hired 4 people. 4 new people are starting on Monday. We're about 200 people, and growing like a weed. So I think we'll be okay. But there's definitely been some impact. There's no doubt about that.
Yeah. Did you plan for that impact to happen the way that it did? Corporations always talk about having, a disaster plan ready. Did you have one ready?
Not really. No. I mean, so we had done this before, and in general, this is now actually the third time we've raised the price of a drug a lot. And so the first time was a 5-fold increase. The next time was about a 20-fold increase, and this time was about roughly a 40-fold increase. So I guess not surprisingly, the quietest one was the 5%, the 5x. The 20x was kind of loud, and then the 40x was deafening. So our plan was just to sort of try to explain why we were doing this and why Turing is like this really insignificant company that with this really insignificant drug that has never been cared for ever, and by doing this we can actually stand a chance to make sure patients who need this product can get it and get maybe a better product on the road. And it all made sense to us when we were talking about it internally. I think what we didn't sort of appreciate was that there were going to be people that didn't want to understand it just for whatever reason that is, or if they were going to try to understand, they were not going to try too hard. And so we didn't really appreciate that. I think we didn't have a backup plan, so to speak, that like we would lower the price or that we would do something rash. I mean, I think a lot of companies, one of the best things you can do when there's bad publicity is you can just fire the CEO. I actually advocate for that quite a bit.
Do you think you should be fired?
Well, no, I don't advocate it for me.
Okay.
I certainly would accept it, if our board and our employees thought it was a good choice, and our investors. But that's not, and I asked, and I guess that's breaking news for you, but I asked my coworkers and board of directors if it made sense for me to step aside, and they said absolutely not. But in corporate America, that's often a decent thing to do, is when there's something like this, you just say, hey, off with their heads, and bring in some new people. And we didn't think that would really fix anything. We
So
definitely did.
Yeah, so not to interrupt, but you
Yeah,
said we didn't think that that would fix anything, including yourself.
I
What did they come to you, or did you ask them, like, "Hey, do I
I
need
asked
this?"
them.
And
Yeah, I
when
asked them. I said I'd be, more than happy to resign if you think this is a good idea, and they said no. Our employees especially thought it was a terrible idea. Um,
when was this?
this was during the first
The
few
first
kind of days of the
days.
controversy. Yeah,
Okay.
because ultimately I work for my shareholders, I work for my coworkers, I work for our patients, and I don't work for the media. But if that's what's best for the company as a whole, and it's a little selfish too. Don't get me wrong. I own a big part of the company, so if it makes sense to put in someone else that could clean up our reputation or something like that, that's okay. I'm a big boy. I took my last time my board didn't want me there. I stepped aside. That's the right of the board. I don't fight these things, and I don't. A lot of companies, a lot of guys set up their companies so the board can't fire them.
Yeah.
Um, and I respect that. The board should be independent. They're not my golf buddies. They're guys that really are truly independent and would be more than happy to throw me under the bus if they had to. But I think they felt that it was best for the company to keep it for now. That might change in 3 months. That could change in 6 months, a year. I am the largest shareholder, so I have a say, but I tend to like not really use that say as much as maybe other people in my position would, because I still think you have to be really selfish to not consider the 200 people that work here, the 100 investors that we have.
Mm-hmm.
Those are all really important people, and I can't put myself above them. So I offered my resignation. They or at least wanted to talk about it, and they did not want to really talk about that. Um, so there was no real good backup plan. That's kind of the default backup plan, I think, and
Okay.
so we kind of have improvised since then. And at the end of the day, no matter what you think of kind of our quote unquote media strategy or media actions, um, I was on the phone with a patient just yesterday morning, and I told him to make sure he doesn't pay one penny out of his own pocket to our company, because ultimately we should have a system, whether it be his insurance or our copay assistance or our patient assistance. There should be a way that he doesn't have to pay anything. And that patient, his name's Ryan. Um, his doctor called me and said, "Look, Ryan may need some help with his emergency room visit, because the emergency room visit was really expensive." And I'm checking with my lawyers to see if I can help or not. It's a pretty complicated thing, it turns out. But I'm going to make sure we find a way to make sure that his life wasn't interrupted because of this drug. But there are people out there, kind of reminds me, like, his problem isn't our drug. His problem is just the entire system is pretty screwed up, and sitting in an emergency room is $500, and for this guy, that's too much, and he needs someone willing to help him, and we're willing to do that so long as we abide by all the regulations. But it's kind of frustrating to see that. Like, there's one guy who reached out to me who has multiple sclerosis, and he has this ridiculous bill, and he's also not, a millionaire like 99% of us. And he, I donated $5,000 or something to him. I'm not even sure I remember how much, but there's this company Biogen that has billions and billions of dollars, and they have absolutely no interest in donating to him at all. And I understand it's not a drug company's job to donate to anyone, but if you look really deep into the kind of stuff we've done over the years, my last company, at this company, I actually think we're probably one of the most charitable companies, and it just sucks to see people not understand that. And you know, I'm not going to try too hard, because, like I said, the reason I started the story was that at the end of the day, my duty's to the patients and
Yeah.
the doctors.
Mm-hmm.
And if you judge me by that mark, which is not, there's not too much transparency or visibility into it, but I'm sitting here on vacation trying to help this guy get our drug, and not even really get our drug because he's got our drug, but get help for his other medical problems, which have nothing to do with our drug. But I still think it's a community, it's an ecosystem. We have to take care of each other. If we're in a position, our company is lucky enough to be, fortunate enough to be able to help, we should do that, or meet me personally. So anyway, that's a
Yeah.
long-winded
Yeah.
way
No. No.
of
No.
saying something.
No, definitely, and I think that is important because what I wanted this interview to be about was us to hear, and already I can see and feel and hear like a different tone than what we see and hear and sometimes then feel. Reading quotes from you or seeing clips from you from a television interview. When you were, I think it was MSNBC or CNBC, or someone, but that first interview that you were doing, um, uh, you were very different than you are now. And do you regret kind of how you responded to some of those questions? And what made you come back on ABC or NBC, one of the majors, that the next day or the day after, and say that you would lower the price? What made you make that decision?
It's a really tough question. So I guess, look, I mean, I'm still not apologetic about what we did. I think it's a really complicated situation, but ultimately, it's a positive thing for everyone involved. And we'll talk about that as long as you want. In terms of coming back and saying we would change it, I mean, I kind of regret doing that because ultimately, I still have this tremendous conviction that what we're doing is the right thing. And I think that by lowering it, even if it's a little bit, I think that everyone gets what they want, I think, which is, it's embarrassing for me to turn around on our plan, which I've, again, tremendous conviction is a good idea, but to show people that I'm listening, I'm not, just going to ignore, this feedback. We're going to lower the price, but while I've got the microphone and the podium or I guess the floor, to be able to say, look, I really want you all to understand why we're doing this. It has nothing to do with greed. It has absolutely nothing to do with greed. There's no uh, there's no motive here just to create a lot of profit. There's other ways to make money. We've done really well up until buying this product. We'll do really well after buying this product. It certainly doesn't hurt us to make more money, but it's not our sole motive, and I don't think that's the case. And so having the platform and being able to continue the conversation as opposed to doing what everyone else does, which is no comment, no comment, no comment. Spokesperson was unavailable for comment. No, thank you. I'm not going to discuss this. I mean, let's talk about it. I'm a drug company CEO and entrepreneur. Um, I have one of the fastest growing drug companies of all time. We did this really controversial thing. I'm proud of it. I stand behind it. But I hear you all. I'll lower the price, but I'm still going to be talking about this. I'm not going to go away.
When are you going to lower the price?
It's a good question. I think pretty soon. So
I'm begging you to tell me. Is it like 2 weeks? How long did it take you to raise the price?
well. So that's a good question. So we started talking to the company that sold us the drug. I want to say in March, and I think we closed the deal in September. So you can see how long these things take. And we're negotiating and negotiating, and part of what we're negotiating. Sorry about that. Can you hear me?
Yeah, I lost you there for a second. You were negotiating, obviously through September, but when
Yep.
you actually acquired the drug, um,
Well, we were deciding along the way, right? So we initially offered like 30 million or something, and actually that was it. We offered 30 million, and they said no. um, and we said we really want this drug, and so we ended up agreeing on 55 million. By the way, most of that money was my money, so it was you know basically my life savings, and I we had to come up with a price. And along the way, you don't just sort of say, "Oh, here's 30 million." You make all these calculations and you say, "Okay, well, here's how long it would take to get my money back, and here's kind of the all the things that might happen if we raise the price." Because we didn't raise the price, the drug was doing 5 million, and basically, I don't think we'd ever break even.
right, I
So
get that.
yeah, so we had to come up with a price where we would break even. And there's also, At some point, probably some competition coming. I don't know when. It's really hard to tell. But you can make like scenario 1, it comes soon. Scenario 2, it comes a little later. Scenario 3, it maybe never comes. And you average those out. And so through this really complicated formula, we decided that 750 a pill or 775,000 for a bottle was a reasonable price. We also calculated kind of like what other drugs cost. Like, so Sovaldi is a drug that has been really, really popular in the media and news. It's a drug for Hep C, and it cures Hep C, and it costs more than our product for a curative treatment. And Hep C is not as severe as toxoplasmosis. Toxoplasmosis kills you very quickly without treatment, whereas Hep C is a very, very, very slow-moving disease. And toxoplasmosis is very, very rare. There's only a few thousand people who have it, and Hep C, millions of people have it, like 3 million people. So the way I thought about it was that, well, we if we're less than the Hep C product, we really can't be blamed for it. And obviously that was wrong. We were blamed for it. So we crunched the numbers. That's the decision we came up with. And I think that, if we lower the price, when we lower the price, I should say, it'll be a modest decrease.
What?
And again, yep.
Yeah. So what does that
And
look?
it'll be in a few weeks. I don't expect it to take a lot longer. One of the issues, I'll just finish by saying this. One of the issues is, so we get our sales data every week,
Okay.
and we haven't made our money back, and it's hard to tell when we'll make our money back. It's a little difficult for me psychologically and business-wise to lower our price until we make our money back, because again, I'm our largest shareholder, but I'm not our only shareholder. And for us to do something that would hurt us financially, I think that's it's actually, I even think, illegal. Technically, under Delaware law, you have to do what's right for your shareholders, not what's right for maybe your media persona. And that's the law, and you could be sued for that.
So are
In
you
fact,
like 2/3 of the way there? Are you more? A couple weeks. You said. Like how far away?
yeah, I think that's right. A few weeks, is probably right.
Before
Now
Thanksgiving.
probably,
Okay.
yeah, almost certainly. So
Okay.
we have kind of some language written up. I think the thing to understand about this that's really unique is the hospitals are the ones who are affected the most. By far and large, we don't see any problems with kind of your average Joe going to his physician and saying, well, I have this headache and I don't know what's happening, and he gets his blood drawn, and the doctor says, oh my God, your CD4 count's really low, and your symptoms of confusion or headache could be toxoplasmosis. I really need to give you Daraprim right away. That patient has no problem, as far as we can tell. It's the patient that really sadly, Josh, shows up in the hospital and maybe ER even, and is basically in a situation where they sorry, I'm just adjusting something here. They're in a situation where they sorry, just my charger. The nothing too exciting.
I'm
They're in a
like,
situation where they
is your PR guy in the car? I'm just curious.
no
No? Okay.
just, here in a parked car.
Okay.
No, just me and my phone.
Okay.
And you. So the guy that shows up in the ER and is basically maybe he's carted in, maybe he stumbles in, but he basically is really, really, really sick. That's a patient that's going to get admitted. That's a patient that needs to stay in the hospital for at least a day or two while the doctors figure out what's going on, and that's not obvious right away. They're going to test for toxoplasmosis. They're going to see it, and immediately they're going to say, okay, you have toxoplasmosis encephalitis. I need to get you on something as soon as possible to get those active toxoplasma bugs, which are called tachyozoites. Need to kill the tachyzoites. Tachyzoites is how you say it, and that's a so-called active infection. And there are a few options for that. There's Daraprim, which is considered the gold standard, and there's another drug called TMP. And so the problem is there are and again, this is pretty protracted and complicated, but if you have the time, I'll tell you.
Yeah, absolutely. I mean,
Most ho-
yeah, I still want to circle back to a few things, but I'm really
yeah,
interested in what you're explaining is actually pretty interesting. Not just about this drug, but it's showing that you are not just a money guy, right?
thanks.
That you take interest in all of these medications that you work on, and just in health in general. That you're a
Yeah, I mean,
scientist. I mean, you have patents, right?
yeah, I do. I consider myself a moonlighting scientist. I'll explain that later. But so anyway, the patient comes in the hospital. Most hospitals get our drug for $1, which is great. And that's really complicated too. So that's $1 a bottle.
Mm-hmm.
So that's a penny a pill, really. And so that's about 60% of all the bottles we ship out of our office, out of our warehouse, go out for $1 a bottle, which is pretty cool. So that's something that very few people know. And I can send you in. A lot of people have been asking me for independent proof, and I trust you enough. I can send you that independent proof because I'm certainly not making it up. I actually wish 100% of our drug we got full price, but the laws and regulations suggest that we have to sell 60% of it for $1 a bottle, which is a pretty deep discount to the 75,000. In fact, it's the lowest price we can charge, so it sort of has to be $1. We can't even sell it for $0. So anyway, most hospitals have that going on, but there are some hospitals that don't. And so one of the problems our price increase created is that there are hospitals that really don't want to buy a $75,000 bottle because this is a very rare disease. As I mentioned, only about 2,000 people get toxoplasmosis encephalitis a year in the U.S. So some people say, oh, Martin, millions of people are going to be affected by your decision. And I'm sitting here scratching my head like, well, we only have 2,000 people who need our drug. So, I think the 0.1% of patients who are going to have some problems, that's 2 people. And I'm here. I'm going to make sure that those people don't have a problem.
Has
So
has
anyway,
there been anybody in the process thus far, since the controversy, we'll just call it that hasn't been able to get the medication because of finances?
no.
Okay.
There was a guy in the Massachusetts area who came close, but I stepped in and made sure that he got it for free. He is an illegal alien, legal immigrant, whatever you want to call him. More than I don't have any political view on that. As far as I'm concerned.
We can move through that. I'm not gonna get you to
Yeah,
yeah.
yeah. Everyone's welcome. My parents are immigrants, and so anyway, those patients often have a really hard time kind of getting cared for regardless, because hospitals don't love patients like that because they're sitting there saying, how much money do we want to spend on this guy? And I'm not sure he's ever going to pay us, right? And so that dynamic occurs quite a bit. And so anyway, he had toxoplasmosis, and we made sure we got him the drug. It was difficult. It was definitely difficult, but we got him the drug in about 3 days. And it took time. It took effort. It went all the way up the food chain through six different levels to my point where I called the hospital myself and said, whatever it takes, no matter what we're doing, no matter what I'm doing today, this guy's getting the drug. And we got him the drug. And but as of now, what's remarkable, Josh, is you haven't seen one person in the news, either in any of the papers, blogs, or any of the TV shows. They can't find one person that hasn't gotten our drug.
I've
And that's
looked.
because
Yeah.
we try really, really hard. And that's important to me. I'm not going to have this premium price without premium service. And
So if you're raising the price, who is paying it? And that's the
it
part that I think that the majority, possibly, of the internet doesn't, and probably what you wanted to talk to Bernie Sanders about. But just as a regular Joe or regular Josh here, I don't understand if the pill costs $750 a pill and 75,000 whatever for the bottle, and that's not what people are paying. Then who's paying it?
Yeah, so obviously we have kind of two systems in this country. We have the employer employee insurance system, which is kind of where we make pretty much all of our money.
So
And then we've got,
from corporations.
yeah,
Okay.
corporations contract with insurers. Insurers pay for drugs. Obviously, employers and corporations will charge their employees for healthcare. It'll come out of their paycheck. Um, Sometimes it doesn't, but it certainly is still going to be a cost for all of us at the end of the day. No matter how you slice it, we all share in healthcare costs. Maybe you work at a great company that is like a Google or someone that doesn't charge you for healthcare, but most people, some of their paycheck is going to their healthcare insurance. And certainly the things like copays and deductibles and all that stuff, that contributes out of your own pocket too. So certainly there, no one's actually forking out $750 for each pill. I would, really not be able to live with that if that were the case. That's not a tolerable situation for me. And by the way, as you know, I'm from the rare disease industry where there are, Alexion's drugs $500,000, Genzyme's average drug is about $300,000-$400,000. This is a very rare disease, and it's about $75,000. It's about 50 to 90% off what your average quote unquote rare disease drug costs. In fact, new cancer drugs are about $100,000. So it's kind of similar in cost. In fact, a little cheaper than most of our peers. So that being said, there's the government channel, and so for Medicaid, it's $1 a bottle or a penny pill. For 340B and PHS, it's the same, and then for our free patient drug program, it's zero. And then with our copay program, it limits the out-of-pocket costs to $10. So, you're right that it never really hits anyone's pocket. But
So putting this, I've seen stuff on the internet, and I just want to give you that chance to respond to it. That you are, benefiting and profiting off of the sick people off their backs, and do you think that was fair? I mean, obviously, by what you explained, it kind of gets spread out by all of us or by corporations, and how the healthcare system that you didn't create, the healthcare system in general, just kind of operates and is expensive. Do you think that was fair, that you've been characterized as somebody, if not even one person has yet been found that couldn't get the drug because of finances?
yeah, I don't think it's fair, but at the same time, like when people say, "Oh, you're profiting off of sick people," to me, if you want to be cynical, you could say that's every drug company. I mean, when Pfizer sells Lipitor to someone with high cholesterol, I mean, technically they're profiting off someone who's technically sick. And I don't know that that's a bad thing. That's kind of the big divide here. Like, I think that if there are companies that'll make great drugs for really sick people, and they charge a price that's not going to hit that person out of their own pocket, but it's going to be spread across the system, I think that's a wonderful system. And then we have the safety net. As I said, it's not like a small safety net. 60% of our bottles are going through our safety nets, where they're for $1 each or less. So I think that's great, and there's this incentive for a better drug. To me, the biggest tragedy, and I think you would know this from where you sit, is with the million or so people who are HIV positive in this country, 20% of them roughly have toxoplasma in their system, and it's being kept at bay, thankfully, because they're on HAART. And because they're on highly active antiretroviral therapy, their immune system can keep the toxoplasma enclosed in something. It's enclosed in the cell through this glycoprotein, and it's called. They're called bradiocytes when they're encysted, and they're called tachyocytes when they explode out. And so while they're bradiocytes, they don't affect you, which is great. But the problem is, if you're compromised and you're that 20% of the million HIV patients, of those 200,000 patients, and you're toxopositive and you're HIV positive, it's kind of a ticking time bomb. Because as you know, if you take a treatment holiday of 3 days, you can get resistance and you can get AIDS. And then if you're toxopositive, the toxo will surely be a huge problem for you. So to me, what would be a really cool thing is that if we can create a drug that can kill latent toxo while it's encysted, and that way the million people who have HIV are at serious risk for toxoplasmosis encephalitis can get rid of their toxo and not have to worry that if they ever do fall into AIDS, whether it be over the short term or over the very long term, that the toxo won't be problematic. Now, it's obviously a bit of a fantasy because we honestly are very far away from creating a drug like that. I've seen a couple of animal papers that seem to suggest it's doable, but it's early days. Having said that, our company this drug will never be a blockbuster drug. A blockbuster drug is a $1 billion drug, right? Truvada, Atripla, Stribold, all those drugs are $1 billion drugs. This drug has no hope, no hope of ever becoming a $1 billion drug. We'll be lucky if it's a $100 million drug, and so a tenth of a blockbuster. So the system is about a $500 billion system. So if our drug is a $100 million drug, then it's not even 1%. 1% would be 5 billion. It's not even zero. Yeah. It's not even 0.1%. So to get upset about it is like saying, it's really kind of bizarre. It's like yelling at one raindrop in a storm and saying that raindrop, that's the guy that's causing the problem. And the reality is, drugs are expensive in this country. If our drug is too expensive, there'll be competition. The amount of money that Gilead made on HIV when everyone else was basically ignoring HIV, guess what happened? Vive stood up and said, holy shit, they're making a fortune. We're getting our asses kicked with our inferior drugs like some of their old drugs like Combivir. And they said, we need to step up our game. And now they have this great new drug called Tivicay that seems really, really good. And all of a sudden, Gilead's starting to sweat it. And I think that, between all that, and then you have generics on top, I think honestly that the system is pretty well constructed as it is. And our company making a little bit of money and then taking that money and investing it into research for these patients specifically, if you look at kind of who's better off at the end, would you rather have us struggling to make the drug at $5 million, doing no research, doing very little copay assistance, very little help, or this tiny company making a little bit more money and actually spending the time to research this disease, which does need a lot of research? I think it's pretty obvious kind of what the better scenario is for HIV patients.
Yeah. So no. I get what you're saying, and I get the position that you have. And at the end of the day, if I want to sell this pen and I want to sell it for $100 million, you can say whatever you want about it, but as long as I give you this pen, you can't really say much to me about the price because I'm giving you exactly what it is. It's just an expensive pen, right? Where the problem is, I think, maybe, Martin, is particularly, but getting through the internet war against you, and you've been changing some of that, like going on GoFundMe and donating over the past couple nights, and then you did a Ask Me Anything to, obviously you're being methodical in how you're doing this, but it comes back to two things, I think, for a lot of people. One, that you said you would lower the price, and two, you haven't. And so if probably before Thanksgiving, could you say 100% that the price will be lowered before Christmas?
Yeah, I would commit to that.
Okay.
I would say 100%.
And then you said a quote.
You're the first person to get me to do that. So
yes.
Congratulations.
You're awesome. Okay, so you also called it a modest decrease. So yeah, what does that really mean? Does that mean like $100? And I get what you're saying, that it really doesn't matter because these people aren't paying for it. But for those
I definitely want to
and that want to hold you to your word that you would lower the price.
We can do another interview after we do it. The what's interesting is, as I was explaining, this very long-winded kind of pedantic thing is that these hospitals are where the problem, if there is a problem, kind of the hospital's place is the place where the problem is. So what's interesting about the way hospitals work is they stock up drugs, right? And the problem with this drug is that you don't want to stock a lot of it because you almost will never see someone with toxoplasmosis encephalitis. There's
Right.
5,000 hospitals in the United States, and again, most of them, because there's only 2,000 patients a year, on average, it will take 2.5 years for any given hospital to even see one patient.
Right.
So why the heck should they buy a $75,000 bottle from us and sit there and watch it collect dust? That doesn't make a lot of sense if you're a hospital. And these hospitals, they've got money, but at the same time, they are low margin. Some of them are local community hospitals. Sorry,
That's all right. We are almost as soon as we get through this one part where you just explain the modest. Then I want to ask you some stuff that's unrelated. By the way.
cool.
Yeah.
Yeah, so the 75,000 is a big, big, big kind of commitment for a hospital to make, especially if there's no reason to believe that they're going to ever see someone with this disease. And so what we're doing is we're going to be giving discounts to hospitals, substantial discounts to hospitals, in fact. And then we're rolling out a smaller bottle because the commitment to buy such an expensive bottle is really tough for a hospital. Now, again, most hospitals do get it for $1 a bottle, which is great. And we've sent out a lot of $1 bottles. So that's wonderful.
Is
And
that a
there are,
new is that a new thing? I've never
yep,
heard of that. That to send a smaller bottle, like to
well,
the. Have
well,
other drugs done that? Is this something normal in the pharmaceutical industry?
it's it's not that normal. I mean, we basically had to triage the situation. Every hospital had bought these bottles when they were $1,000 or $1,800 because $1,800 isn't so bad, and
Right.
you basically have it there in case you have this toxoplasmosis encephalitis or just a TE patient roll in. And at $75,000, you don't really want to do that just to wait and waste the money because the drugs have expiry dates too, and it's just complicated. So we kind of, as an emergency, said, let's make a smaller bottle. So now we are going to be having at least a 30 count, which will be even cheaper per pill, much less capital commitment for a hospital. And then we're also going to be giving individual hospitals special discounts. Haven't decided how much yet, but I'm thinking as much as 25 to 50% off so that they can afford to stock these bottles for those patients that are, as I mentioned, go into the emergency room. They are in the AIDS territory. The toxoplasmosis has been reactivated, and some of these patients are unconscious. They're in big trouble, and the hospital needs to be able to stockpile this drug in case of an emergency. So we're working really hard to make sure that every hospital can hold this product and not go bankrupt, holding it. We don't want that. We want people to be treated with this illness. So anyway, that's kind of the theory here. Changing the list price itself, I don't think is going to make much of a difference. Helping the hospitals afford it, that's kind of the weakness we see, where if we made sure that the hospitals were getting it for an affordable price, that would really make sure, basically at that point, we'd be pretty airtight in ensuring access. But again, it's the minority of hospitals. It's
Hmm.
a small minority of hospitals. The bigger hospitals, they can afford to pay the 75,000. I'm more worried about the little hospital in the outskirts of Tennessee that doesn't have a ton of patients, and for them, $75,000 is way too much to buy a 100 count bottle if they're never going to see a patient.
True. So, real quick, modest. Just give me an idea of what modest is. Is modest like $100, $200? Any idea what
Like
modest?
10%
Okay.
off,
Okay.
something like that. Where instead of 75,000 a bottle, it's 68,000 a bottle or something like that. Again, I think that it's not. I think you understand where I'm coming from.
Yeah.
It's much less about what does it cost. It's much more about how hard is it to get. Because I think we understand there are expensive drugs out there. I think
Hmm.
some people have been kind of complaining that, well, you didn't invent this drug, and therefore, in fact, it was invented 70 years ago, so therefore it kind of doesn't make sense that you should be making any money on it anymore. And I'm not sure I agree with that either. That's a complicated kind of
Well, yeah. Didn't you?
subtopic.
And it was $55 million that you got it for, right?
Yeah.
Yeah. So, cool. So, I think that we covered that. I did have a couple quick questions for you. Have you heard from Bernie Sanders?
Nope.
Okay.
Where I come from, my mom always told me if you're gonna say something bad about someone, you got to be prepared to say it to their face.
Yep.
And for Bernie, that doesn't apply. I think if you're gonna openly criticize someone, you use their name. You use their first. Sorry about that.
It's all good.
You call them out specifically, and you don't want to actually address that person one on one. I mean, I think that's the definition of being a coward. And um, you know, I don't know what he's afraid of. I mean, if he thinks I'm doing the wrong thing, he could tell me why, and maybe he convince me that I have respect for the man. I mean, he's been alive twice as long as me. He's accomplished more than me. Maybe he could convince me why I shouldn't do this. But I think he's just pandering, honestly, and he's just looking for votes. And it's unfortunate that I know a lot of politicians. Like, I won't name names, but folks more important than him. And I talk to them on a regular basis. And if he can't, speak with me, then it's really says a lot about him.
Okay, fair enough. He gave you donated $2,700, a political donation, the maximum, I think, for an individual. You donated that to his campaign. They donated $2,700 as a sign of not taking your money. They donated it to Whitman Walker Clinic in D.C., and that was the end of it. Now, you had told me something when we had communicated previously that you made a gesture to donate as well. And have you heard anything else back?
I actually just heard. Yeah, I just heard back from them yesterday. They're having a big kind of a gala event, and they actually have all the sponsors they need for that. I don't know if they're just being nice to me and saying that, but they say they have all the sponsors they need for the event. But they did say that they would meet with us. My sister, Leonora, runs our family charity, where we've donated millions of dollars thus far. And we would love to support their organization. Looks like they're doing something really great. And, previously our foundation, our family foundation, was focused on education and health issues. And I think now going forward, we're going to be very focused on HIV issues because I have friends with HIV. My childhood dream was to cure HIV. I'm still focused on that childhood dream, and
that makes me proud, Martin. You are
thanks.
Focused on curing HIV.
I think that we can do it.
Okay.
Finally, I think the time has come. It's complicated, and I can talk to it a little bit,
Yeah.
but I think the time is nearing. And I know a few drug companies out there. I won't name their names, but some of the big 800-pound gorillas also feel that way. So I think that we'll see a cure in at least you and our lifetime, if not in the next sort of 10 to 20 years. But in any event, the point is our family's charity is going to get more involved in HIV. And so this organization's the first stop, and we're meeting with them in a few weeks to see if we can make a nice big donation to them.
Okay, that's awesome. Thank you for doing that. If they, we do me a favor, if they don't accept that donation, we make sure that I know that.
Yeah, absolutely.
Okay. And then, so you play the guitar, right?
Yeah.
How good are you?
I used to be really good. And I won't define really good, but I used to be able to play. I used to play 4 or 5 hours a day. In this time, I can't play every day anymore.
Yeah.
But I still know what all the chords are. I play bar chords. I can play a solo here and there. But I'm very rusty. You play?
No, I don't play the guitar at all. Unlike everyone else in Nashville. I am going to give you a hard time though, because you said you're very hard at defining things, and that is true. We are. It's hard to get you to define stuff. But before Christmas, we're going to get that down. And then I wanted to ask you a couple random facts about a few diseases. What do you say?
I'm nervous, but I'll try. No Google here, so.
Okay. You bragged, and I'm probably going to mess some of this stuff up. Well, actually, let me just start with HIV, though. So right now, the CD4, what is It used to be the CD4, if it was below a certain number, they wanted you to begin antiretroviral therapy. Do you know what that number was, and do you know what the new recommendation is from everyone, including the World Health Organization?
Okay. Again, just to be clear, I'm going to be 100% transparent. When I don't know something, I'm going to tell you I don't know it. I do
Okay.
think I know this one.
All right.
And again, not using Google, no computer around me, just off the top of my head. So I think the recommendation was 500, but I'm not sure. And now I think the recommendation is you start hard no matter what.
Okay.
How'd I do?
You did pretty good. So, do you know? Do you know at what point with your CD4, if it goes below a certain number, that you're considered to have AIDS?
I think I know this, and
You're
again,
killing me. I'm not even going to ask you about any other disease if you don't know about
it's
HIV.
it's either 100 or 200.
Yeah.
And I think there was some controversy around that. I mean, certainly below 100, you have AIDS, but I think around 200 too.
Yeah. It's
Is that
200.
right?
Yeah. So, yeah, 200. But let me ask you this: if somebody falls below 200 in their CD4, but then gets on medication and it comes up, would why are they still considered to have AIDS?
Ooh, good question. Let me think here.
You don't know. I'm not going to ask you any of these other questions I have prepared because
No, it's okay.
you're killing me on the HIV trivia.
Why?
Because you didn't have it all. I thought you were going to be like blowing those away.
Oh no. That's. I mean, I'm just trying to be.
I'm just giving you a hard time.
No. Let's see. So, why are you still considered to have AIDS?
Yeah.
Well, I think you need a sustained rebound, and you want viral clearance, right? So you need the viral load to be hopefully undetectable with
Right.
heart.
Yeah.
You want the CD4 up, and then there's maybe one more thing I must be missing.
There's not. There's not an answer. I was just asking you. I was
I
just
think
asking.
that's it. Yeah. I mean, I think once your CD4 has a sustained recovery, then you're sort of out of danger.
Right. So,
But
but they're still considered to have AIDS.
I think if you make a good CD4 recovery, I think you're back and considered just HIV positive. But I'm not sure. I'm
Um,
pretty sure.
Yeah, well, so not in the U.S. There may be some other countries that they do that, but so if my CD4 fell below 200, then they would say that I have AIDS. But then if I got on treatment and then the CD4 rose back up to say 400 and stayed there, and then the viral load, it has no effect on it, then I'm still considered to have AIDS. So I'm going to advocate just publicly as an advocate that that gives people no incentive if they're sick and their CD4 falls below that we should change that so that they, almost like AIDS went into remission and they're back to just HIV positive.
Right.
Yeah, so
Yeah.
there's like an incentivized thing for them as people. Um, let's one other thing and then we will go. What kind of music do you like? Because that's your famous, always quoted Twitter's stuff has to do with Eminem. What kind of
Oh
music?
yeah.
Yeah.
Well, I like punk rock. I like basically any kind of music that's really aggressive, like very intense. So I like punk rock. I like rap, like not like pop rap, like hardcore rap. So like anything like very, very kind of I guess intense and meticulous. So I like very avant-garde type music. But even like kind of rap music I like as well.
A country artist? Can you name a country artist that's your favorite?
I could. Eric Church, Jason Aldean. I had and was involved with the record label. So for a while, I would actually, Josh, listen to the top kind of Billboard Top 100 to 200 to scout out artists, and good 20-30% of them are country artists. So
Right.
it was such a huge genre that I started listening to it more and more, and certainly started to like it. So you know, I don't listen to country every day, but I certainly, and some of the crossover stuff like Florida Georgia Line or something like that. It's hard not to like some of that stuff.
Yeah.
It's just easy listening.
Cool. Well, this has been awesome. Thank you so much for I'm in Nashville, just an independent HIV activist, and I did want to share with everyone how you agreed to the interview was that I just reached out to you, and you said it was just sure, and then you followed up with your phone number to set it up, and so I really, really sincerely appreciate it, and
Well,
I want to
no,
ask you one last question, and then the interview will end, and then I'll have one more for you offline. But um, who are you? If you could explain to somebody that doesn't know you, that doesn't know the controversy, that doesn't know that you were at one time the internet's most hated man. Who? You always pause after the good questions. There you go.
yeah, no, my someone called me,
Oh,
so every time someone calls me, it breaks up.
yeah,
So I can give it a shot.
yeah, yeah. Tell me who
So
you
who
are.
am I? My name's Martin Shkreli. I grew up in Brooklyn, New York. I love science and medicine. I devote my life to science and medicine. I love researching all diseases, but especially diseases that are very obscure that nobody cares or knows anything about. Especially those diseases with very few medicines for them. I think I can create those medicines. I need help. I have help of a lot of really talented people that help me do that. And I want to make those medicines. I mean, that's my life dream, is to 50 years from now, I want to look back and say I made 10, 20 brand new medicines for very rare, severe diseases that, weren't something like an upset stomach, but there were diseases like Canavan disease, which I'm working on right now, or Lafora disease that, people look back and say, I couldn't have had a normal life without Martin's perseverance and hard work and sacrifice, really, at the end of the day, is what it is, to care about a disease with a few thousand people like toxoplasmosis. And that's the life I want to be really proud of. I don't want anyone to look back and say, oh, that guy was really rich, or that guy was a really great capitalist, or that guy built really big companies. I mean, I think that no one's going to remember, some of the big hedge fund managers or some of the big, corporate guys 100 years from now or 500 years from now. But we remember Jonas Salk, we remember Albert Einstein, we remember people like that. That's who I aspire to. It's not to be a capitalist. And so I think that's really it. I'm also a giving person, a sacrificial person. I work all the time, despite the fact that I don't need to work ever again. And it's because I have a tremendous curiosity as well as a tremendous benevolence. I think my curiosity probably outweighs my benevolence. I'm more, I think it's great that my curiosity helps people, but at the end of the day, there's nothing to me more interesting than a gene that nobody knows anything about and a protein that nobody knows what it does. And it's just the most fascinating thing you can think of is, what's this little machine in my body doing? And when I can't make this machine, why does everything go wrong? And how do I fix it? And that's the most interesting puzzle that you could possibly solve. And solving it actually, is a really important thing for society. Not many people want to solve those puzzles. In Silicon Valley, they're solving puzzles about, I think less important things, but then things like Huntington's disease, where there's this protein Huntington, and nobody knows what it does. And we know that if you don't make Huntington, you get Huntington's disease. And I'd really like to fix that. And it's the most complicated puzzle you could ever imagine. And it's just so much fun. And I love it. And to be able to continue to do this and to have that partially and sometimes fully help people, I think it's wonderful. I've met a lot of these patients, and I want to keep doing that. Certainly it takes a lot of money. I'm a businessman, but I think if you talk to anyone who's done well in business, they'll tell you, and I will tell you, that there comes a point in time where you absolutely don't need more money.
Are you at that
cannot
point?
have fun with
Are you at that point?
Yeah.
You don't need more money?
Absolutely.
Okay.
Absolutely. Yeah. I mean, once you've made a certain amount of money, that extra zero will absolutely do nothing for you other than cause you great misery and harm.
I'm going to trust you on that. So, but I wish that I could experience that for myself, that the one extra zero was too much money.
Well, and it may sound flippant, but I think that I know billionaires who are miserable and millionaires who are really happy, and certainly know people who have very, very little money that are extremely happy.
Right.
And
Yeah.
and so to me, I don't view my job as a mission to make money. I view it as a goal to satisfy my curiosity in medicine, make money for my coworkers. I love doing that. I've got a lot of coworkers who, I mean, I'll tell you all kinds of stories about a 24-year-old kid from Long Island that didn't have a dime, came to work for me 3 years ago, is a millionaire now, and is a really responsible and ethical individual. He doesn't take the money and spend it like a wild person. He's a very charitable guy, and I've got about 24 of those stories of people that have worked for me that have never thought they'd ever become millionaires and now are. And that to me is something that, I mean, I got to tell you, Josh, there's no feeling in the world that's better than that. When you see someone rise above their adversaries, rise above the things that limit them, and they are able to succeed. And it's just such a wonderful feeling that this job has given me. And if you ask around, you'll know that I've given away a lot of my share of the company to my coworkers, which very, very, very few entrepreneurs like me do. They mostly say, look, I started the company, I own the shares. I'll give you some stock options, but I've actually given the shares that I own of the company to my coworkers as a thank you, way above and beyond what you would expect from stock options. So I'd say that's kind of who I am.